Hi, this is Steve Leonard from Leonard Brothers Veterinary Centre. This is the first of 5 talks that we're going to publish on YouTube, and these are broken down parts of a big talk that we gave on arthritis to our clients earlier this year. So let's kick off with Andy's slides. First and foremost, before we talk about arthritis and joints, let's look at a normal joint. A normal joint occurs where you have 2 bones that meet together and that need to move across each other. Those bones are hard, mineralised structures that, if they were allowed to sort of rub against each other, would abrade. So we need a lining in that joint, and that lining is cartilage, the dark grey that you can see there. That provides cushioning for the end of the bones, and it also provides the frictionless surface for them to actually glide over each other. Now, that cartilage is supplied with nutrition by the synovial membrane, which is this pink structure you can see there, which secretes synovial fluid, which lubricates the joint. Now, this is all wrapped up in a fibrous joint capsule, which keeps the whole thing nice and sturdy and stops any leakage. And also, you would have ligaments around that joint. You'd also have muscles keeping that all together as well. So what goes wrong in arthritis? Well, it's a degenerative, progressive, irreversible, and most importantly, a painful disease of the synovial joint. It starts with this inflammation in the joint and the pain associated with that. If left unchecked, you're going to lose that cartilage, that shock absorber, that sort of also that frictionless surface. There it goes, it disappears. Now you've got bone-on-bone contact. Now, where you get that, the body tries to reduce the inflammation and reduce the pain coming from that joint by building up new bone around that joint and fibrous tissue to try and sort of stabilise it. And in fact, severely arthritic joints end up being fused, which is good in some way, because actually when they're that bad, it stops the pain. You just end up with 1 bone instead of 2. But obviously we want to try and preserve the function of that leg and to reduce that whole painful process by trying to eliminate that. It is a vicious cycle. Once an animal is in pain, it stops exercising, it puts on weight, it gets reduced muscle mass, so reduced stability of that joint again, and also that pain builds up and builds up, so they get very, very sensitive to pain as well. Which animals are at risk? Well, actually it's very common. It's 20% of dogs over a year of age, and obviously that increases as they get older. But the key one here is 90% of cats over 12. That's a big number of cats out there. And it's just wear and tear on those joints, especially animals that are overweight or have an underlying problem like an injury to that joint that makes it unstable, and therefore you get knocking in that joint. And that can be from ligament damage like in cruciate injury, or it can be an inherited disease. In certain breeds like elbow dysplasia or hip dysplasia, we can see a lot of arthritis later in life because those joints are not behaving normally. Often in older animals, it's more than 1 joint affected, and we can see it in lots of other joints. As you can see in the cat's picture there, overweight animals are a big problem because they're carrying so much extra load on their joints. Things that you're going to notice in a dog. First of all, no, you can't get arthritis of the nose. It's not a joint. It's basically stiffness, especially after exercise or rest. That's one of the classic first signs that people will bring an animal in for us to have a look at. It's not the fact that they can't exercise, it's the day after. They're really stiff and sore. Or they may have lameness in 1 leg. If they've only got arthritis in 1 joint, that will present as lameness as opposed to a generalised stiffness. Sometimes it's because they can't do something they used to be able to do, jumping in and out of a car or getting upstairs, this sort of thing. And sometimes, especially in the older animals that have what people have thought was just slowing down, that's chronic pain. They're sort of restless, they're inactive, they don't sort of want to sort of settle in 1 spot, they'll pant a lot, they'll look for attention, they want to go in and out, all those sorts of things. So behaviour is a big thing to watch out for. And that can be aggression as well. If they're very sore and somebody comes towards them very rapidly, they can growl, they can bite even. So we've got to be very careful with especially toddlers or other dogs coming running up to them wanting to play. If a dog is in pain, it will try and warn that person not to mess with them, as you'd expect. And toileting, a dog that's previously been very, very clean might suddenly start messing in the house because it's too painful to go outside, or it's too sore to sort of be able to sort of last through the night. Cats are a little difficult compared to dogs because we don't exercise them. We don't sort of take them on known levels of exercise like a walk, where each day you can see a subtle change. Sometimes it can be a very subtle change in them in the fact that they stop going outside, or they start messing indoors, or they stop jumping up onto the bed or onto the sofa. Those sorts of things, little sort of signs, but quite often it's just a change of behaviour. They become clingy, they become sort of aggressive or moody. But a massive one is grooming reduced. Cats obviously groom themselves fastidiously. They lick every part of their body. They're very flexible. And if that flexibility decreases, you'll notice their grooming stops, and therefore they get the mats in the hair, commonly down the spine, which is where they need that real flexibility to turn around and lick down their back. So if their hair starts to get all matted and clumpy, that can be a sign of arthritis. Now, when we see animals with suspect arthritis, one of the things we'll be doing is talking to you about all of those signs, but also looking at the animal quite carefully. We will examine those joints. Sometimes they're painful on movement when we sort of bend and flex them or extend the hips. That's quite a common one. The dog will turn around, or the cat will turn around or vocalise and say that's sore. Sometimes it is a very subtle lameness. When it gets advanced, you notice that there's a loss of range of motion. That means that basically one leg will fold up lovely and the other leg will only go half the distance, and that's an indication that there's something stopping that joint from bending. That can be because they're swollen, because of the build-up of bone, or even you're getting a bulging joint capsule, so that synovial fluid in the joint is actually starting to increase in volume and starts to push out and balloon out around the joints. Crepitus, that's a technical term for sort of creaky joints, and that's where you're getting a build-up of bone around the joints and it starts to crunch, and it creaks, and you can sometimes hear it or feel it when you move those joints, and that's a sign that that joint is getting diseased. Muscle atrophy is muscle wastage. Now, this is quite a subtle sign because sometimes you get a decrease in muscle because the animal's not using that limb, it's favouring it, and the muscle is wasting away. So even if you're not sure that there is lameness there, you can actually feel over the one leg on one side and the other side, and if it's a bit thinner and bonier on the one side, you know that it's not using that leg. So how do we diagnose DJD, which is degenerative joint disease or arthritis? Well, all of those things we've just talked about. The history, the breed of the animal, the age, the weight, all those things, and also the clinical exam is very important. Now, we do like to image, i.e. X-ray or MRI or scope these joints, most commonly X-ray, because it gives us an indication as to what processes are going on in that joint. There are other things that can cause lameness in dogs, and that's we always have to consider things like tumours and various things like that in older dogs, or also ligament damage, cruciate damage or other problems that are treatable in a different way. It's not just always arthritis. But on this X-ray of an elbow that we can see over a dog's elbow, you can see there's fluffy bone actually developing all around that, and that's the body's response to a loose or unstable joint that's inflamed. It's trying to stabilise it by growing new bone, and that's a good indication that there's arthritic processes going on in this joint. Occasionally the joint looks normal, and what we do in some of those situations is to pop a needle into the joint, take a sample of the fluid, and if there's inflammatory changes in that joint, then we can see that when we send those samples off to the lab. So, treatment. What we use is an A to E system. We'll explain all of those in the following videos. So, arthritis video 2, 3, 4, 5, 6. We'll go through all of those treatment plans. The important thing is we will be able to make a big difference to each of these pets with arthritis, but the earlier we intervene, the better, because it is a progressive and irreversible disease. So if they get so bad that the joints are really thickened up, there's lots of new bone, we're not going to be able to bring those back. So the treatment is going to be lifelong, and the earlier we get involved, the better the prognosis for that animal will be. Not all cases will need the full A to E treatment, and each one will be judged on an individual basis. So thanks for watching this video. Have a look at the others. They'll explain the treatment plans that we lay out. for each individual patient.